Okay, this is Biel's quick tour of the lungs. If we look inferiorly, you can see the diaphragm here. Coming through the diaphragm is the inferior vena cava. The descending aorta, once it comes through the diaphragm, becomes the abdominal aorta, and the esophagus is over here. The base of the lung is what sits on the diaphragm. The basal surface would be called the diaphragmatic surface. The right lung has 3 lobes. The superior lobe of the right lung is right here. This is the horizontal fissure separating the superior lobe from the middle lobe. There's another fissure here. This is the oblique fissure separating the middle lobe of the right lung from the inferior lobe of the lung. On the left side, you can clearly see the cardiac notch. You can see the left superior lobe. You can see the oblique fissure on the left side and the inferior lobe on the left side. If I remove the lungs from the front here, you can have a good shot of the heart here. You see the superior vena cava, you see the ascending aorta, and you see the pulmonary trunk coming up. The aortic arch on the top that you can't visualize super great. The first branch right here is the brachiocephalic trunk right here. The second branch, this one here, is the left common carotid artery. The third branch that is you can't see very well, would be the left subclavian artery. That's this one here. The the brachiocephalic trunk here does fork again, and at the bifurcation, it becomes the right common carotid and the right subclavian. So when you look at it from this view, you can see the symmetry of those arteries. Just know that off the top of the aortic arch, you have just the 3 branches, the brachiocephalic being the first one. When you remove the heart itself, and you look in here, we can see the trachea coming down. The trachea is this structure. You can see the blue C-shaped cartilaginous rings that keep that opening patent for you. The carina would be inside this structure. The 2 branches of the trachea are the primary bronchi. Number 38 is on this left primary bronchus. When the left primary bronchus branches again, it becomes lobar bronchi or secondary bronchi. The left lung has 2 lobes, so it's got 2 lobar bronchi. On the right side, this would be your right primary bronchus. When that branches again, these would be secondary bronchi on the right-hand side or lobar bronchi. Since the right lung has 3 lobes, you have 3 lobar bronchi. If we continue looking, you can see the esophagus coming down here. Again, this would be ascending aorta going up. Aortic arch kind of goes around the back. And this is the descending aorta here. Since it's above the diaphragm, it would be the thoracic aorta, number 37 in there. If you look at the entrance to the lung, the indented area where all the important structures enter and exit would be the hilum. The bronchi come and go into that spot. The red and the blue are the pulmonary arteries and veins, the red being the pulmonary veins, the blue being the pulmonary arteries. Same thing on the opposite side. That's Biel's quick tour of the lung.